Hello and welcome to another edition of COVID Conversations. I'm Harold Fisher. This week, just as we are hoping to move beyond the COVID pandemic, there's word of another virus causing concern, and health officials are scrambling to contain it. Before we jump into today's conversation, let's begin with the headlines. We are another step closer to an approved COVID vaccine for children ages 6 months to 5 years. Pfizer says its vaccine appears to be safe and shows strong immune response. Pfizer's plans to submit the trial data to the FDA will come later this week. Meanwhile, the FDA says it will meet next month to discuss Moderna's emergency COVID vaccine request for kids 5 years old and under. Global reaction is also growing to the increasing number of monkey pox cases worldwide. The U.S. is moving to release a vaccine to combat the rare virus. So far, there are as many as 5 suspected cases in the U.S. Those are the headlines. Now, for today's guest, Dr. Melissa Clarke. She is one of our show favorites, and she's co-founder of the Black Coalition Against COVID-19. Dr. Clarke, thank you so much for joining us again. Good to see you.
Delighted to be here, Harold. Thanks for having me.
So let's get right into it. The vaccine for the very young is seemingly just around the corner. It's good news for parents who have been waiting. What are your thoughts about it?
Well, look, given that it gets approved, because it still has to go through a review process, I feel very positive about it. Like you said, it's been over a year and a half now that we've had vaccines for adults, and parents with young children have been waiting anxiously to have an option. And right now we're on the upswing of a surge, so it makes it even more important that we are able to protect our youngest members of society. As you mentioned, Pfizer, this is actually, an ongoing development process. Initially, they had a vaccine for with 2 doses. They found that was not effective. They gave additional 3rd dose and have now claimed that what they found is a 80% effectiveness in this age group, 6 months to 4 years old. And so as possibly as early as this summer, the FDA will meet and potentially approve this.
As you just mentioned, we are seeing cases climb again, but vaccinations are declining. Now, how do you convince parents to get the job done and get their kids vaccinated once approved when it's still a bit of a struggle to get adults to get that second booster?
Yeah. Well, I think we're in strange times right now, Harold. Cases are on the upswing, but the message still isn't getting out about the effectiveness of the booster. And so when it comes to kids, it's also important to know that COVID does have effects in children. Close to 500 children have died from COVID. 75% of them have been children of color. And many more children have had no signs of infection, but have gone on to develop symptoms of what's called the multi-system inflammatory syndrome in children, or MISC, which is potentially life-threatening. Children end up in the hospital with this because of COVID. And then another 10% of children, even if they have no symptoms, go on to have what we know as long COVID. So symptoms related to COVID infection that last for weeks to months after the initial infection, even if you had no symptoms initially. And we know that vaccination helps to decrease the spread of COVID. So as kids go to daycare or to school, it can protect them. It can protect those they encounter whose immune systems are low. That could be their teachers, their fellow classmates, and even the family that they live with. So this is really important to get that message out.
This kind of reminds me, when you're talking about the messaging, it seems to me as if we are in the same position that we've been pre-COVID when you talk about the flu, where there's that undercurrent of messaging. You see it on television, you hear it on the radio, you see it online. Get your flu shots. because you don't want to get sick. But there doesn't seem to be the same kind of concern with COVID, just like you don't see it relevant to or relative to the flu. Your thoughts about that? Are we getting into that same kind of space?
And I think you're talking about that debate that people have about, whether COVID is endemic now. And it's
Yes.
not. It is not. Endemic means that there's a constant low level of it existing in the population. We're not there. We're still in a pandemic where multiple countries are having outbreaks. And also, pandemic is defined as increases in cases day over day. That's what's happening right now. We've had a doubling of cases of COVID just in the past month. We've gone from 70,000 cases a day to 150,000 cases a day right now. And it's harder to tell in this environment because even those are a gross undercount because, as you know, so many people are just testing at home now, right? And so they're not reporting it to the authorities that are following the cases locally. So we know that 150,000 case count a day is a gross undercount. And then even if we go by the CDC criteria about, being concerned locally in your community, which is that hospitalizations are on the rise, hospitalizations are on the rise. We've had a 22% increase in hospitalizations just since last week.
Mm-hmm.
There are also new variants on the horizon. Long COVID is real, like I just talked about. At least 10% of people who get infected go on to get long COVID. We know there are about 1 million people who right now are on disability because of long COVID, and that disproportionately affects people of color. It's harder to get diagnosed. So at Black Coalition Against COVID, we're going to continue to use the evidence and the data to sound the alarm because Black people are still disproportionately being affected by COVID. 1 in 500 Black people have died from COVID since the beginning of the pandemic. It's not over.
So let's switch gears a bit and talk about this new and maybe not so new concern about monkeypox. What is that?
Monkeypox is an infectious disease similar to smallpox, but much less deadly. Other pox viruses we might be familiar with is chicken pox, right? It's spread by a pox virus that's normally in wild animals, but in the past has jumped to human beings. And we have seen, it's still very rare, right? We have seen cases around the world in the last couple of weeks increase. There have been 131 cases confirmed since about May 7th. And it's outside the countries where it is, quote unquote, endemic. And we just talked about what endemic means, meaning a constant low level in the population.
Mm-hmm. So what are the symptoms?
So the symptoms start off with like a flu-like illness. So fever, headache, malaise, fatigue. And then after about 6 days of that, you get some swollen glands. And then after that, the day after that happens, you tend to get a rash, which starts on the face and spreads through the body. They look like little mini boils, like chicken pox, right? But then they scab over and dry up. And after that, you're pretty much no longer infectious. But that whole, the presence of the rash and the time you're infectious can be up to about 3 weeks.
Okay. And is spreading it the same way that we deal with COVID? Is this airborne? Is this tactile spread? What?
Yeah, great question. Large respiratory droplets, which tend to not go more than a few feet, is one way that this is spread, as opposed to small respiratory droplets with COVID, which can go much further and hang out in the air for a longer period of time. So it's much less contagious than COVID, as well as infected bodily fluids when they touch an item and then somebody else touches it. So clothing, for example, if you potentially handle somebody's clothing or wear it, that has been affected. So those are the two ways, but it's much less contagious than COVID is.
Now, a vaccine, there are vaccines for monkeypox, correct?
The smallpox vaccine actually appears to work against monkeypox and be 85% effective. So I think in your initial description of the news, you mentioned that the Biden administration is now releasing some of our stockpile of smallpox vaccine to protect those people with a low immune system who might be most at risk.
So, with that said, and I'm trying to bring this full circle because, as we know, the COVID vaccines are not cures.
Mhm.
Is the monkeypox slash smallpox vaccine that would be used to treat monkeypox, is that a cure just like we have for smallpox? Help me with how this vaccine could work against monkeypox. Is it to control or is it to cure?
So I want to be really clear with our audience. Vaccines are not treatment. Vaccines are for protection, for
Mm.
prevention, right? So it's just like putting your seatbelt on in a car. It doesn't prevent a car crash, but if you get in a car crash, it protects you. And vaccines protect you by increasing the antibodies, which are proteins that your body makes that are specific to a particular virus or germ, right? And those antibodies act like soldiers and take them out, those viruses and other germs, specifically if you come into contact with them. That's how all vaccines work, whether it's for COVID or monkeypox or smallpox or pneumonia, whatever it is. And so by getting it ahead of time, before you're exposed, it allows your body to mount a response, to create those soldiers that are then going to take out whatever you're vaccinating against immediately once it's identified.
Mhm.
I know a lot of people, who got sick with COVID, ended up in the hospital, were on death's door, so to speak, and we're saying, "Wow, can you give me the vaccine?" And that's not how it works. It doesn't treat, it prevents.
I see. How serious do you believe we should be taking monkeypox? As you know, we're still dealing with the difficulties of the COVID pandemic. You know, we have COVID fatigue, obviously, and now here's this monkeypox thing. Uh, but is it, or is this something that people should be taking seriously?
Look, COVID is much more proximate. It's much nearer to us in terms of a concern in our everyday living than monkeypox is, right? We've only seen, like I said, 131 cases worldwide. The CDC has put out an alert in this country where there have been about 5 cases, mainly to clinicians, so that clinicians know, read up on monkeypox, refresh your memory on what it looks like, so that if you do happen to come in contact with a patient, you'll immediately know what it is and you can report it. It's not necessarily an alert to the general public, but the basic things that we're doing for COVID are going to protect us, which is hand washing, masking. As I mentioned before, these respiratory droplets for monkeypox don't travel as far as the ones for COVID. And then most importantly, avoid close contact with somebody who might be infected, somebody who has the rash, somebody who has, fever or swollen glands. You want to avoid close contact with them. But again, it's very rare. And I should mention right now, the cases that we're seeing have been spread by sexual contact.
Hmm. Interesting. Okay. Dr. Melissa Clarke, always good to talk to you. Good to see you again. Thank you so very much for your insight and your expertise.
Harold, thanks so much for having me.
Absolutely. And thank you, the listener, for joining us for another week of COVID Conversations. We promise to continue bringing you the experts to help you go beyond the fear to the facts about COVID and other health issues. We want to make the best decisions and to help you and your family do the same. I'm Harold Fisher. Have a healthy, happy week.